As COVID-19 cases reduce in the country, many people are again becoming reluctant to follow the preventive measures like wearing nose masks, washing hands, and observing physical distancing. Walk around Monrovia or Bengal cities, most people you will see are not following any of the preventive measures. This creates a concern that if the country is not mindful, it might experience a resurgence of the virus. This means the good news right now that we have only 41 active cases in the country might turn bad and more people might get infected again. But why should people continue following the preventive measures like before? Sarifina Senda, a junior student of the Public Health Department at the University of Liberia, she insists that despite the decline in cases, the preventive measures should be upheld.
We should keep following the preventive measures because we want to continue in the decreasing of COVID-19 and protecting an individual from getting this disease. And we know that following the health measures have been helping us because the disease has been decreasing. As a public health student, I don't want human lives to be at risk. I don't want people to be dying from a disease that we can prevent from going on. Without following these preventive measures, I believe that we will go back to where we will find people dying from this illness, people getting sick from this illness. These preventive measures contribute to our health by keeping us safe.
Like Sarifina Senda, Sarah P. Harris, a pharmacist who lives in Bengal City, also stressed the need to keep following the COVID-19 preventive measures.
The measures are highly contributing to the decrease in the virus status in our country. You can remember at the heat of the COVID-19, all over the places, community boys gather and put the drum at the starting point of each junction, compelling everyone to wash their hands before entering institutions. So it's important for us to follow this preventive measure because looking at our country, we have poverty rate, we have ignorance rate very high. It might be that you have taken the vaccine and you have already built your immune system, but there are others out there who are still denying the fact that COVID-19 are here and they are not doing their vaccine, they are not going by the preventive measure. So I would say it's preferable to always go by your measures because you don't know when and who are those people that are not going by the rightful procedure concerning taking their vaccine and going by the preventive measure.
While people like Horace are encouraging people to adhere to the COVID-19 preventive measures, others are calling on health authorities to push for a more robust enforcement of the preventive measures. One of those is Dauda Balamu. Balamu says if everyone is made to follow the health measures in the country, there will be reduction in complacency.
If we relax, there's a potential means that we might go back to where we came from and what we are afraid of. We don't want to go back to where we came from because it was disastrous. So my advice is that people should keep wearing their masks and follow the people. Mind you, there will got some people that will want break rules. They will feel relaxed. The government get their own role to play. If there's any case, the government has to come back to see our best to ensure all of the preventive measures listed by the health practitioner that it should be named up to by all costs. Like what they were doing when we had the 10 variants here. Security people all around, ensuring that people wear their masks. They should still maintain. Why is it the security come around to ensure that we wear masks? The security is not doing anything now. So I think that they should be on the street ensuring that people wear their masks and all preventive measures that they need to do.
So, what are health authorities doing to ensure the country doesn't slip into red again? This will mean the public adherence to the preventive measures as vaccination of people with the Johnson & Johnson and the AstraZeneca vaccine continues across the country. Justice Smith is the risk communications lead at the National Public Health Institute of Liberia. He said the decrease in cases should serve as a means of encouragement in following the necessary preventive measures, being vaccinated, washing hands, wearing nose masks, among others.
A decrease in COVID cases does not mean in any way that COVID is finished. I think it's just a testimonial of how Liberia is doing very well in terms of managing its cases. Yet we cannot be a country of complacent people, especially right now. There's a fourth wave in countries that have the capacity, they have money, they have the infrastructure. We can only hope that our Liberia will continue to adhere to the health protocols in terms of washing their hands, keeping off the video clubs that in crowded areas and all the fill up parties and things, and I'm going to wear our masks wherever we are, get vaccinated. We will continuously engage the community.
The active COVID-19 cases have dropped significantly, but the threat of the virus is not gone yet. Remember that before early June this year, Liberia cases were in one digit, but when the new wave of the infections hit, by early July, the country recorded more than 2,000 active cases. Public health experts have warned that following all the preventive measures and getting vaccinated are the best ways of stopping the spread of the virus. The concern is, with the growing reluctance in following these very important measures, what could happen next? Reporting for K News, my name is Siawe Meapo.